Hey, you got a question about how would estrogen dominance affect my thyroid? So the question implies some understanding of the relationship, and there certainly is one. Now, estrogen causes the body to make a compound called thyroid binding globulin. We always make some, but the more estrogen we have, the more of it we make. And it's just a parking brake on your thyroid hormones. So when it's there, your body has to work a little harder to compensate. And if it's at a steady amount, by and large, a healthy thyroid or someone on appropriate thyroid replacement, that can be worked around. But when it changes, as it does during difficult menstrual cycles, premenstrual changes, and also perimenopausal changes, when there's big fluxes of estrogen, the system may not really be able to keep track, and that may lead to temporary thyroid deficits or excess. Now, this is also relevant for oral contraceptives and hormone replacement, especially when starting or stopping either, because they change how your body responds to thyroid. And specifically, the more estrogen you're consuming and making, the more your body blocks thyroid. So if someone were on a contraceptive and thyroid treatment and they stop their contraceptive, they may need less thyroid treatment. And ideally, doctors would be aware of that and think of that ahead of time. But in many cases, it's more so after the fact. Someone might retest and say, wow, my levels are off. Why would that be? But shouldn't be a surprise. They certainly do tie in.